Hi, I'm Instructor Williams.
I'm Instructor Maciel.
Today we're going to talk to you about Block 3 of Medical. At the start of Block 3, you will state your field impression to your proctor. If your field impression is correct, you will be allowed to continue with Block 3. You will have 7 medications that you need to learn. If none of those medications apply, you will do 4 things: transport, position of comfort, O2 therapy, and keep them warm. Please reference your pharmacology video for the remainder of Block 3.
Hello, I'm Instructor Maciel.
And I'm Instructor Williams.
This is Block 4. Block 4 occurs en route transporting to the hospital.
Once you've loaded your patient, there are 5 things that you continually go over en route. The first one is checking level of consciousness. The second one would be checking ABCs. The third one, redo vital signs or blood pressure, checking for trending. Fourth one would be reevaluate P, Q, R, and S. We don't reevaluate O because we already know the onset, and we do not reevaluate T because we know how long ago it started. And then the last, follow-up interventions if needed. The way this is going to look is like this. Please check his ABTO again.
Okay. Sir, how you doing? Patient is tracking me. He is alert.
Please reassess his ABCs.
ABCs, we're going to start with airway. Airway is open, clear, maintainable. Breathing, we're going to go ahead and get the rate, def, ease. We're also going to reassess his lung sounds. And I will also get my SpO2, and I will also relay all the vital signs to Instructor Williams. Circulation, we're going to start with radial carotid pulse. We're going to get the rate, rhythm, quality. We're also going to get the skin signs, color, moisture, temperature. We're also going to reassess his cap refill and relay all findings to Instructor Williams.
If there are any changes in his respiratory issues, we can either decrease the oxygen or increase the oxygen at this time. If there are any changes in his circulation, we can also address that as well by patient positioning and keeping him warm. Could you go ahead and get me a blood pressure, please, Instructor Maciel?
Absolutely.
He's going to get a blood pressure now because we're going to check for trending. We know what our last blood pressure was, and we want to make sure that we're still in the same frame. As he does that, I'm going to move on to evaluating P, Q, R, and S. P. Sir, last time you said sitting down made your pain less. Is that still the case, or has anything changed? Q. Last time you said your pain was sharp. Is it still sharp? R. Last time you said your pain went to your right shoulder. Does it still go to your right shoulder? S. Last time you said you rated it on a 7 from a scale from 0 to 10, 10 being the worst and 0 being no pain. Is it still a 7? What was the blood pressure?
Blood pressure is 160 over 82.
At this point, I would move on to secondary round of interventions. Please see your pharmacology review video and interventions to go over those medications that you can use a second or even a third time. You would do this, continue to do this, if the patient is unstable every 5 minutes. If the patient is stable, every 15 minutes. Instructor Maciel, explain to them once you get to the hospital about giving a verbal report.
Once we arrive at the hospital, all these findings, vitals, everything, all the information that you've gained from the patient, you will then document on your patient narrative, and you will relay this information to the doctor and to the nurse in the ER so they can perform the proper care and continue on from there.